If you're waiting on your employer to bring up your raise, you'll be waiting forever. Your MP Pal here. Welcome to another conversation from the track. All right, so for today's video, it is how to ask for a raise as a nurse practitioner. All right, so I started this finance series last week, so this is video number 2. So definitely something I want to talk about, because if y'all been watching my videos, I like to give the true and honest way that things happen out here. A lot of these lessons, actually no, the majority of them, things I've personally gone through and dealt with. So I'm trying to give y'all as much information as I can, that way hopefully it'll help to save you time. Also, my voice, I had a cold over the weekend, so my voice is coming back, so forgive me if it's not clear, but I'll try to speak as loud as I can. All right, so when it's time for a raise, right? So this is my 9th year as I approach a decade of practice. I've had a bunch of jobs if y'all have watched my other videos, but yeah, what has been consistent across the board is that they're not just gonna sit you down and, hey, let's talk about giving you more money. They're never gonna do that. And the thing is that because if you're still early on, nurses in the hospital, things operated differently, you know what I mean? So where it was automatic. Like, you had to do your self-evaluation. Like, you knew when it was coming. You got emails and stuff like that. And it was typically like a set date. But that doesn't happen in this role. Not at all. And so, yeah, they're not just going to come and, hey, let's give you more money, okay? So you have to ask them straight up. You have to ask them. Now, you don't have to do this in person. I am personally a fan of emails, just because you have a paper trail and stuff like that, because I know how forgetful people can be, because I've brought it up or mentioned something. Oh, yeah, we'll do it. And then some time go by, and then now you have to ask them again. And so no, send them an email, okay? So just the way that you do it, though, so you don't come out, hey, can I get more money? You ask for an evaluation. Hey, can we do my annual evaluation? And they know what that means, okay? They know what that means. Usually they'll say, oh, yeah, we'll set something up. So one thing that does is it keeps it professional, but also with the evaluation, because what they're supposed to do is, be keeping track of your metrics, your numbers and stuff like that, feedback from patients and all of that. So some places, like my first job, they had like these surveys and things like that, but whether they do it or not, they're supposed to have some kind of form where they kind of grade you and things like that. So even if you work for a smaller company, they should have that. But that helps because that forces them to basically go and look through it, you know what I mean? And look at your numbers and all of that stuff there. So that way there's something to talk about when y'all do have to sit down, versus just you basically having to sell yourself, okay? So most of the time it's automatic, and they go over blah, 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 they go over your numbers, and then they just automatically do it. Again, I don't know how many jobs I've actually had total, but this year I've experienced something I've never dealt with before. So I've been working for this company for over a year, and I sent the email out, hey, when can we have my evaluation? Oh, yeah, we'll do it, blah, blah, blah. So I had it in January. Right now, it is the middle of May. So we had the evaluation, and he went through all the numbers, because this company, they track everything, basically, as far as, like, what your numbers and your what's your percentage for certain conditions? Did you pick the right antibiotic? Just all this crazy stuff. So, I mean, a good 20, 25 minutes in, because I'm thinking in my head, can you just get to how much it's going to be? Like, that's what right? And so he got through the whole thing, and then was like, okay, so, you happy with this? Is this anything else? I'm like, is there something about an increase? Like, he didn't even bring it up. So did you really think I just wanted to talk about my numbers? Like, no, the numbers I'm talking about are the ones that's on my check. Like, come on now, man. So anyway, and so I had to ask him, and he's like, Oh, okay. Like he had no idea that's what I wanted to actually have this conversation for. So, and now, mind you, this is my PRN gig. And so some of the stuff, I guess, I felt like he should have known, but he kind of went over and like went back and looked at everything he just talked about and then was like, oh, so how long you been practicing? And just wrote some stuff down. He was like, okay, well, I'm going to get with the team and we'll reach out to you in a couple weeks. Cool. Now, again, this is my first time dealing with that particular situation because either they're going to tell you you're getting one or you're not. That's usually how it goes, you know, like if the company's struggling or they're uncertain, then they'll just tell you, hey, we're not doing any increase this year. Just let me know. But I'm so used to being let down and just disappointed at places. I don't even expect it anymore. Like I'll have the conversation and I'm already thinking no. So if I get a yes, if I do get something, it's a surprise, to be honest. Like just because I know how these things operate. So this was in January when I had this conversation. Out of sight, out of mind for me. Fast forward, it's mid-April. I'm like, he never even reached out to me. Now I have to send a follow-up email. Hey, sir, you said you were going to reach out to the team. Are y'all still discussing? Like, what's going on? Crickets. I got nothing for like 2 weeks. He just popped up at the clinic. Oh, yeah, you want to talk about that thing? Sure. Okay. I already knew it was a no. You didn't even respond to my email, and then you want to come have a face-to-face. You're obviously going to tell me no. So you could have just put that in the email. So basically I had this long speech about how the company is, he first said basically the finances were on hold right now. I get it. It's May of 2026. There is so much going on in the world right now. I don't expect much from these employers. Like I'm just, I'm grateful to still have these jobs right now. You know what I mean? And I'm not dependent on them to give me more money so my life can be better. So that's fine. I understand the situation and I'm reasonable. So he started off saying that they said no, and then 20 minutes. And then, well, yeah, if we switch you over to part-time, maybe I can sell that a little bit better. Okay, I'm going to drift a little bit and talk about this whole PRN thing. So once upon a time, PRN compared to part-time and full-time, usually you used to get paid a significant difference if you were a PRN person. Just because you don't get the benefits. You know what I mean? Like you don't get 401k, you don't get nothing. So that was the incentive for being PRN. Like, give me an hourly rate. Like, I'm still coming to help y'all. But that's not even the case anymore. So he's basically trying to say that if I was part-time, then that could get me more money, which is crazy because so now I work there probably 4 or 5 shifts a month, which is about 1 shift a week. Sometimes like I'll do 2. But I get to choose when I want to go work. So, and then there's some times where I just work 2 days a month and it's fine. So, but this part-time will basically be 24 hours a week. So now y'all saying I have to work 2 shifts per week. I have to if I'm part-time because my main job, I just do 312s and I'm done. So with that, if I would have done that, I would have lost my control because now I can kind of pick up when I want to. I can go wherever I want to. If I switch over, then, and he made it clear, he's like, now this is still no benefits, but it's just, we can probably get you, a little more money. So I didn't even waste time with that. I just stopped. No, thank you. Now here's the thing. Let's spend a little time on that. So let's say if you make $75 an hour, right? 12-hour shift. Before taxes, that's $900. If they give you a $10 raise, so you go from $75 to $85, what's the difference? So 75 12 hours is $900. 85 times 12 is $1,020. It's $100 difference. What is $100 going to do? So that don't even really matter. And I know it wasn't even going to be that much. It'd probably be half of that, or maybe $3 or $4. So in the grand scheme of things, what is the raise wasn't even going to do much anyway. It's better to pick up a side shift. You know what I'm saying? Just add one more shift to what you're doing per month, and that's more money than how much that raise would have been. So that's another thing that I talk about, is having more control over my time, because that's one thing that they can't take from you. You know what I mean? Like, it's bad enough that we're having to work so much and we're all underpaid anyway, but yeah, they just want to take from you. So I told him on the spot, I didn't drag this out for another 4 months. Oh, let me think about it. No, thank you, because I don't want to have to work that much. And that was the end of the conversation. So it's like sometimes you may have to, even with the ask. And then my main job, I've been having a raise pending also since January. I'm not holding my breath for none of this stuff. Okay, so they're not just going to automatically give it to you. Again, you have to look at the grand scheme of things, like what's going on. And right now, again, in May of 2026, there's a lot going on in the world. We got AI, we got wars, we got a lot of uncertainty right now. So usually companies, they don't make a lot of big things. And you have these tech companies that's laying off. So I don't expect much right now as far as getting paid more. Now, I hope that you do, but just know, yes, you deserve a raise. Yes, you should get one. Yes, we're all overpaid. But they don't have to give you anything. They don't have to. They don't have to. Okay? And I'm even doing this because it was early on. I remember because I was working urgent care, but I had a side job at this like hormone and weight loss clinic. And I remember I was training this new provider, and I was just talking to her, talking. And then it just hit me in the middle of a conversation. I was like, man, I've been working here for 2 years and I haven't got a raise. Like, he didn't even say anything. And I remember right there on the spot, I was like, hold on, let me make a phone call. And I called him straight up. I was like, sir, so this guy, he was kind of crazy. So he talked to people crazy. Like, that was just his, like, the way that he approached you. So for me, I gave him that back. So I was like, sir, what's going on, man? I was like, hey, I've been here for 2 years, and I listed all the things that I did as far as patient care, positive, feedback. I had even referred some patients over there to them. So I'm all the things, to kind of show my value. He's like, you're right, Carl. Give me 5 minutes and I'll call you right back. The way he said it, I did not expect a call back, because I know when I say that to people, I have no intention of calling them back. But it was crazy. He called me back in 5 minutes. He was like, okay, so yeah, we're going to bump you up $5. And if you go, because they had like different locations, he was like, if you go to a further location, then we'll pay for your mileage and blah, blah. And I was like, okay. And again, that was just one quick phone call. But had I not said anything, they'll let you just work there 2, 3, 4, 5 years. If you don't say anything, they won't bring it up. So you have to ask for it, okay? You have not because you ask not. That's scripture, but it's true, okay? So don't be afraid. You don't have to be awkward about it. Just send an email. That way there's paper trail. And you may have to actually come out and say it. Actually come out, okay, is there anything with an increase? Is that actually happening right now? And you may have to do a follow-up, but if that's what you have to do, then that's what you have to do, okay? All right, so I hope this information was helpful, especially for my newer providers, because it's tough out here, and it's bad enough that we're already underpaid, but when you have providers that are taking these lower numbers, like I know some people that $35, as low as $35 an hour for nurse practitioner, people are taking that. So that's another reason why they're kind of being a little stingy with raises, because it's like, like you're trying to get to 80, but if they got somebody that'll take that much, no, they're not going to pay you more money. I'll just find somebody that'll do the work for $50 an hour. Like, and they'll let you go. Like, they'll lose a really good person and let the company be short and let everybody stress out to find somebody that'll take something cheaper. All day they will do that. I've been in all those situations. So it's not okay, but it is what it is, okay? All right, so this is video number 2. Next week, stay tuned. I'm going to talk about the management raise. Is it actually worth it, okay? All right, so if you found this helpful, hit the like button and subscribe. As always, your MP Pal here. Think clearly, practice boldly, and I will see you on the next one.